My name is Dr. Patrick O'Leary and I work here on spine surgery. I'm a member of the spine service and we do spine operations on the cervical, thoracic and lumbar spine. There are different regions of spine. The cervical refers to the cervical spine, the neck from the skull to the shoulders, and then the thoracic spine is where the rib cage is, front and back, and then the lumbar spine is from the rib cage down to the pelvis. And we do operations sometimes from the side, sometimes from the back, and sometimes from the front. There are different approaches to the spine these days, and there are more options with regard to care. The first thing you got to do is make accurate diagnosis. In order to make an accurate diagnosis, you got to listen to your patient and take good history. You got to do good examination. You got to get the proper studies done. Then when you gather all your facts, then you can say, now this is your diagnosis, this is the problem, and show it to the patient so they understand it, and these are your options of care. Some operations are emergency, some are elective, and some are based upon quality of life. And you got to make sure you phrase it in that context to your patients so they realize that. Patients who are informed can make better decisions. Your job is not to tell them what they should do, but tell them what their options are and explain the risks and benefits of those options so they can make an informed decision. And that's your job for when you see for consultation. I always tell the patient, you know, you may go home, you will read my report, you may have more questions. Please feel free to come back and ask more questions. Either come back in person or send me a text message or send me an email, because you should not go into the operation with important questions on your mind that have not been answered. And my job is to answer your questions before the operation, not explain why I didn't do it afterwards. A hospital for special surgery tends to attract the best doctors. And the best doctors tend to attract the best patients, and then its reputation. And so special surgery has been around for a long time. I mean, I've been associated with this hospital for over 40 years. And in this city, you know, good news travels fast, and word of mouth, people say, you know, you go to such a doctor, he's a great surgeon, he'll take good care of you, and the hospital's a great hospital. So it speaks for itself.